Hi, I'm the Total Joint Nurse Navigator here at Reston Hospital Center. Thank you for setting aside a little bit of time so that we can go over what is required for your surgery and give you a little bit of information so that you feel prepared. Objectives for class. We want to set some realistic expectations of what to expect during your stay at Reston Hospital Center. We want you to understand important concepts regarding pain management, blood clot prevention, and fall prevention, comprehend the discharge planning process, and learn tools to optimize your recovery after surgery. Who is a good candidate to go home the same day as surgery? This will be discussed with your surgeon during your pre-op visit in the office and again on the morning of your surgery. Different things to consider include partial knee replacements, patients with excellent health and mobility, and patients who receive a Makoplasty partial knee replacement. Procedures. You will be having either a knee or hip replacement. Pictured here is an example of a total knee replacement. A total knee replacement is the removal of damaged bone and cartilage from the thigh bone, shin bone, and kneecap, with insertion of an artificial joint or prosthesis. A total knee revision is a replacement or revision of a prosthetic implant in a patient who previously had a total knee replacement. A unicondylar or uni knee replacement means a replacement of only half of the knee joint with a prosthesis. A total hip replacement is the removal of damaged bone and cartilage from the thigh bone and hip bone, with insertion of an artificial joint or prosthesis. A total hip revision is a replacement or revision of a prosthetic implant in a patient who previously had a hip replacement. For any specific questions regarding your surgery, please speak with your surgeon. Things that must be done before your surgery. You must schedule a pre-op appointment at Reston Hospital within 30 days of your surgery. Please call pre-admission testing to set up your appointment. We have a nurse practitioner available who can complete your medical clearance during your visit, rather than you having to go to your primary care doctor. Please let pre-admission testing know if you would like to utilize this resource. During your pre-admission testing appointment, the nurse will complete your lab work, EKG or heart screening, an MRSA and MSSA screening in your nares. They will also give you your carbohydrate drinks along with instructions on when to drink them and instructions for the HIPAA wash that you will use the night before and morning of surgery. The pre-operative carbohydrate drinks are given to help your body prepare for and recover from surgery, and the HIPAA wash is important in preventing infection. Please bring the following items with you to your appointment. Orders from your surgeon. Please bring the entire pre-op packet given to you at your surgeon's office. List of all medications currently taking, including supplements, name and address of your preferred pharmacy, and lists of past surgeries, medical conditions, and major hospitalizations. You will receive a call from the hospital if your surgery time changes within 48 hours of your scheduled surgery. Before surgery. Physical therapy must be scheduled at an outpatient clinic prior to you coming for surgery. This is mandatory for all knee replacement patients. For my hip replacement patients, this is only necessary if ordered by your surgeon. You may pick any facility that is convenient to you as long as it is within network for your insurance. You do not need doctor's orders to call and set up your initial appointment. I would just search what facilities are close to your home and pick whatever one has the best reviews. While all of our surgeons prefer outpatient therapy, if there are extenuating circumstances and you are wanting home health, please talk with your surgeon about this prior to your surgery. A front-wheeled rolling walker is required for your surgery. This must be obtained prior to your surgery. A rollator or walker with 4 wheels will not work due to safety risks. This may be purchased from any store. Amazon has been the cheapest that I have seen. Reston Hospital does not have walkers to give you for discharging home. A cane will be necessary to use on the stairs. If your toilets are low to the ground, a bedside commode can be used to raise the elevation of the toilet seat. A shower chair is also a good option if there are no rails in your shower. A grabber is another good resource for reaching items that fall on the ground rather than bending over. Preparing your home. Stairs are completely okay after your surgery. It is a good idea to install at least one railing for safety going up and down the stairs. Nightlights are helpful, especially in the bedroom and bathrooms, and removal of any clutter or obstacles is necessary. Prepare ice packs or purchase an ice machine in advance from your surgeon's office. A cheaper option if you do not want to purchase the machine is Karo syrup, Karo. Simply fill a Ziploc freezer bag about halfway with the corn syrup, zip it closed, and stick it in your freezer. Please arrange for someone to stay with you at least the first week after surgery. We do not want you home alone in the immediate period after your surgery. Please arrange in advance for someone to care for your pets. What to pack for your hospital stay. Loose-fitting clothes, non-skid shoes, preferably tie with a fully enclosed back, your regular toiletries, a long charging cable for your phone, and any other items you may need for your stay. For those patients who use a continuous positive airway pressure machine or CPAP for sleep apnea, you may bring your machine from home. Please bring your mask and power cord along with your machine. If you are not planning on bringing your machine, please bring your mask and know your settings. Day of surgery. Please arrive at the hospital 2 hours before your scheduled surgery time. Follow the instructions given to you by the nurse during your pre-op appointment regarding when to stop eating and drinking, when to drink your carbohydrate drinks, and what medications to take or not take. When you arrive at the hospital, you will go to the perioperative or pre-op holding area in Pavilion 2. A family member may remain with you while you are waiting for your surgery. The nurse will prepare you for your procedure. You will see your doctor again for any last-minute questions, and you will meet the anesthesiologist who will administer your anesthesia and work to control your pain. From pre-op, you will be taken to surgery. Family may wait in Pavilion 2 where there is free Wi-Fi and a coffee shop and cafeteria. Surgery normally lasts around 2 hours. After your surgery, you will be transferred to the Post-Anesthesia Care Unit, or PACU. Here, you will recover from your surgery until you are awake and stable. Usual length of stay is around 1 to 2 hours. Do not be alarmed if you wake up with a Depends pull-on on. Urinary incontinence is normal after spinal anesthesia and will resolve in the hours following your surgery. From PACU, you will be transferred to a private room in the same-day surgery unit. The PACU nurse will keep your family up to date on your condition and let them know where they can meet you once you are transferred out of PACU. While in the same-day recovery unit, your family member may stay with you until discharge. You will likely still be drowsy from the anesthesia given, but this will resolve during your stay. Usual length of stay on the unit is around 2 to 3 hours. The nurse will administer any additional antibiotics, work to control your pain, and coordinate with physical therapy. When you are awake, alert, and your legs are awake, the physical therapist will practice walking and navigating the stairs. If you are feeling well and pass physical therapy's assessment, you will be discharged home. What to expect post-op. You will have a polar ice machine on your knee or an ice pack on your hip depending on your surgery. You will also have foot pumps or SCDs, sequential compression devices to both legs to help prevent blood clots. You will have a waterproof dressing that will stay in place for a specified period of time. Specific instructions for your dressing will be discussed later on in this video. For my knee replacement patients, you will have an ACE wrap surrounding the knee with a waterproof bandage underneath. This will stay on for 24 hours. It is also very important that nothing is under your knee. This is because we want your leg to be straight. If there is something under the knee during the healing period, it can cause your leg to be bent and not straighten. The same-day recovery unit has boxed lunches and water, juice, and soda available for you. Your safety is our #1 concern while you're in the hospital. Always call for assistance before getting out of bed. You may be more unsteady than you realize. Pain management. You'll have either spinal or general anesthesia. Nerve blocks and other medications are administered during your surgery to help with pain. Thigh pain and soreness is expected after surgery. There is a preoperative cocktail of medications given to help with your postoperative pain. The listed medications are the usual meds used. Some, such as Celebrex and gabapentin, depend on the patient and their medical history, whether they are administered or not. Pain management. There is as-needed or PRN pain medications available to you. Typically, this is oxycodone that can be administered every 4 hours. You must call and ask your nurse for pain medication. It will not be automatically brought to you. There are multiple side effects such as nausea, dizziness, drowsiness, and constipation. Please let your nurse know if the pain medication is not working for you. If you have an allergy to oxycodone, or if in the past it has not worked for you, please let your surgeon know before surgery. While we cannot make the pain completely go away, we do want you to be comfortable enough to move around while at home. Blood clot prevention. Being active is the #1 way to decrease the chances of developing a blood clot. You will also be prescribed a medication to prevent blood clots. It is very important that you take this medication as prescribed. If you have any abnormal bleeding problems following your surgery, such as dark stool or nosebleeds, please call your surgeon's office. A discharge order is placed by your surgeon once you are physically and medically clear. This is a collaborative decision based on many factors. Greater than 95% of our patients go directly home with outpatient physical therapy. At home, the role of your caregiver is to assist with mobility, self-care, transfers and repositioning, maintaining ice, and assisting with meals. Steps to be discharged. You must have worked with and be cleared by physical therapy, receive your last dose of antibiotics, be medically stable, and change into your regular clothes with the help of staff. Your prescriptions will be sent electronically either a few days prior to your surgery or at the time of discharge, depending on your surgeon. Your incision will be covered with a waterproof dressing. You may shower once you are discharged with the bandage on, but please do not soak your wound or remove your dressing until instructed by your surgeon. Instructions will be given to you in your discharge paperwork. These dressings are moisture wicking to keep any drainage off of your skin. They are also antimicrobial, meaning they are working to prevent infections and keep the area clean. Some drainage on the dressing is very normal. You will receive a packet of discharge instructions prior to discharging with everything that you need to know for home. Pain will likely increase towards the end of your first week of surgery, usually days 4 through 6. This is normal. You will have an increase in swelling and bruising in the first couple of weeks after surgery. Both are also normal. Bruising can occur anywhere from your hip all the way down to your toes. Ice and elevation will be your best friend during your recovery period. You may ice as much as you can tolerate. Please make sure there is always a barrier between your skin and the ice. Motion is lotion. We want you to get up and walk a little bit every hour while you're awake with your walker. Your walker will be needed the first 2 weeks following your surgery for your safety. There is no set time or distance for walking, just small amounts of movement every hour that you can gradually increase as you recover. Take the narcotic pain medication as needed. Be aware of the side effects and take a stool softener as long as you are taking the narcotic medications. You may need them the first 1 to 2 weeks. As the pain starts to subside, start to wean off of them. Most patients are off of the narcotics within 2 weeks of surgery. Sleep in whatever position is comfortable. For my hip replacement patients, if you are sleeping on your side, you must have a pillow between your legs. Again, for my knee replacement patients, absolutely nothing under your knee during your recovery period. To prevent infections, keep everything nice and clean. Wash your hands, keep pets away from your incision, and minimize your exposure to assisted living facilities. For any dental work, please ask your surgeon for the specific amount of time until you can have this done. To avoid any traumatic complications, please avoid risky situations such as standing on step stools, ladders, and so on for at least 4 weeks after your surgery. Don't forget, aspirin after surgery is to prevent blood clots, not to treat pain, and is not optional. Have your first physical therapy appointment set up within 2 to 3 days of surgery. Bring your front-wheeled walker with you the day of surgery. You may keep it in the car instead of bringing it into the hospital. Keep your discharge instructions nearby for a quick reference at home. Plan ahead. Make your home accessible and safe. Take your pain medications as needed and be aware of the side effects. If you don't need it, don't take it. Rest, ice, and elevate. If you have any questions, please contact the Total Joint Nurse Navigator by email or phone. Thank you for choosing Reston Hospital Center for your total joint replacement surgery. Above all else, we are committed to the care and improvement of human life.